Welcome back to the Osteophysio YouTube channel. Today we're going to be talking about our best exercises to help with hip osteoarthritis or wear and tear, and also when to refer and seek additional advice. Hip osteoarthritis is defined as degeneration or wear and tear of the hip joint. So it's where individuals start to experience wearing and narrowing of the joint space around the hip joint, and that is the link between the acetabulum and the femoral head. Our hip is absolutely vital. It's one of the biggest and most important weight-bearing joints in the body, and therefore if you're starting to feel a little bit of wear and tear or stiffness or soreness into the hip, it can massively impact day-to-day activity and your lifestyle. We're thinking of osteoarthritis of the hip. There are complete variations in terms of the main symptoms that arise when this happens. It can be either extremely mild, so you might find waking up in the morning it feels a little bit stiff, a little bit sore around the hip, in contrast to severe limitations in moving, unable to weight bear through the hip, and obviously dramatically impacting what you do day to day. So the first thing, and most commonly what we assess for, is how are the symptoms presenting with you. Most commonly we find it's worse when you put any weight through the joint itself. Typically the pain is localized around the groin area, so when people come in, they will express feeling soreness and pain and sharpness around the front of the hip. Also a dull ache around the side of the hip and around the back of the glute. So it can be either very local or very widespread, depending on what other structures are getting involved to help with that movement. Most commonly in terms of the daily pattern, it typically peaks first thing when we wake up, where it feels quite stiff and sore, feels relatively improved or a little bit easier on moving, and then peaks again at the end of the day where you've used the joint and the muscles around the area. It can normally be predisposed by 3 different causes. It's either idiopathic, so it comes on for no apparent reason. It can either be due to previous trauma, so any high impact sports or any issues into the hip joint itself, and can be also linked to other conditions. So if someone comes in and in their past history they have something called dysplasia, so abnormal formation of the hip joint, or impingement, or any other inflammatory joint conditions that can predispose potential wear and tear and damage into the hip joint. So what do we do as osteopaths when someone comes in presenting with potential hip osteoarthritis? So initially for us it's working out, can we have a positive impact on that person, or do they need to refer for further imaging? If the symptoms are quite mild and when testing through there's no loss of any range of motion and it feels relatively comfortable on moving, we can help to improve with hands-on treatment, improving range of motion and advising them specific exercises to get the hip joint moving, which is what we're going to have a look at today. If they come in and we start assessing and it's been getting progressively worse, or they're significantly limited on movement, or if there's any kind of wastage or atrophy of the muscles surrounding the hip joint that help with their movement and support of the hip, we would be thinking, we want to find out what's going on in case there's any bony fragments that have formed or there's significant joint space narrowing, but also we need to work out, does this person potentially need other surgical intervention, for example a hip replacement. So it's really important to assess this, work out what's going on with that specific person and refer them on when needed. What we're going to be covering today with our exercises is the best exercises to get the hip moving and strengthen around the hip if the symptoms are quite mild, and that hopefully we can improve with exercises and conservative treatment, but also they can be used post hip replacement once you start to move and it's feeling a lot more comfortable, to regain function and stability around the hip joint. So the first exercise we are looking at is standard gentle hip extension. The reason why is with most people with significant wear or tear, if they're recovering post-op, it was this movement that was lost in terms of weakness, as the most amount of pain was going up into flexion and internal rotation. So we want to fire the glute max and improve that range of motion to help with recovery. So you're going to bring the leg back straight, relax for a second and then back to neutral, aim between 10 to 15 reps, and then we're going to move into gentle hip abduction. So again, this is going out to the side. This can feel particularly weak if we've had hip osteoarthritis or we're repairing post-surgery, because it's very normal for the glute medius minimus, which does this movement, to be weakened. So we want to aim to regain the movement before we do any strengthening, and only bring the leg up as high as you feel like you can go. Lovely, slow and controlled, aiming for 10 to 15 reps, working on actually both sides, not just the bad side. Next, we want to look at trigger point release around the side and the back of the glutes. Again, it's really common to get that deep points of tightness when we have an injury or if we're recovering. And so what we can do is find a point of tightness. I'm doing it on the side of my garden, but you can do this on the side of a bed if it's nice and firm. And you want to sit onto the trigger point ball or a tennis ball, and you want to take the pain to about 8 out of 10 and then hold it until that pain releases. Once you've done that, we can then move into a stretch of your psoas. So again, you're gently lunging forward. You want to stretch around the front of the hip. This might be too much on your knee. If it is, you can always try a different stretch later, but you want to aim to lunge forward to allow that release around the front of the hip, aim between 10 to 15 seconds. What we also encourage, if you've got hip osteoarthritis or wear and tear, is to get that movement into the lower back. Same if you're watching it post hip replacement, you want to regain that movement into the lumbar spine, as very common for it to become very tight and sore. So aim between 10 to 15 reps of swaying the knees side to side. And then we want to take that gentle hip extension that we looked at initially and turn it into a strengthening exercise. So again, holding onto a chair, you're going to kick the leg back, aim to hold for 5 seconds and then relax, looking at between 10 to 15 reps. This is really important that we're regaining this over time, because if we can fire up through the glute max, which is what this movement is firing, it's so much easier to help protect and support the hip joint. Once you've done 10 to 15 reps, holding for 5 seconds and end in hip extension, we can then move into gentle hip abduction. So exactly the same as the movement we went through at the beginning. You want to bring the leg out to the side, hold for 5 seconds and then relax. You want to regain the strength into your glute medius and minimus to help with that pelvic support and also help with the support of the hip joint by building the muscles around, so much less likely to put more pressure on the joint and help it move better. So we want to get that movement back. This might be enough for some people. If this is not a challenge or you want to up the ante later, we can look at a sidelying position. So again, we're bending the knees up. You're going to separate the knees, hold for a couple of seconds on end range and then relax. And this is firing for your glute medius and minimus. Again, we're firing the muscles to help support that joint. If we can get a lot of strengthening in the surrounding muscles, so much less likely to put extra pressure on the joint and will help with movement long term.